Hello everyone. As we all know, every year on March 24, people around the world observe World Tuberculosis Day to raise awareness about the disease. On this special day, we have a very special doctor, Dr. S Sandhya, to give her valuable insights about the disease.
Hello everyone, I am Dr. S Sandhya. I am consultant pulmonologist in Kailash Hospital, Sector 71.
So, ma'am, please give us some overview about tuberculosis or TB.
Today, as we all know, we are here to commemorate World TB Day. Nobody is unaware about the disease of TB, that is tuberculosis. Everybody knows somebody in the family or in the friends must have had this TB. TB is an infectious disease, but the main thing, it is preventable and a treatable disease. The world prevalence of TB is very high, but especially in India, it is much higher. Almost 28% of the world TB cases are in India, both primary TB and multi-drug resistant TB. Though our government and everybody has been trying a lot for the elimination of this TB as a menace in the society, but somehow because of various factors, this has been continuing, the TB turning into multi-drug resistant TB, and still it is spreading. This year, the World TB Day is being commemorating for spreading awareness about the disease as such, to remove the myths about the disease, and to make people aware about the treatment opportunities and treatment modalities, so that people can come forward in case of TB or any symptoms and take proper treatment and get treated.
Yeah. Yes. And ma'am, what are the causes for the disease tuberculosis?
Tuberculosis is mainly caused by bacteria, Mycobacterium tuberculosis. In fact, the TB Day is also celebrated today because this was the day when Robert Koch, the doctor, who came up with the concept that this is an infectious disease, mycobacteria, that is causing the TB disease. So this is usually spread from patient to patient through cough droplets, sputum and other factors. Though TB can occur in any part of the body, but it is mostly the lung TB, the pulmonary TB that usually spreads. So if somebody with a sputum positive TB or a lung TB who coughs without covering his mouth, who spits anywhere and everywhere, and who does not follow proper hygiene practices, they can spread TB in that manner by coughing, by sneezing, by the particles which come through their mouth in that ways.
Okay. So how is tuberculosis transmitted?
As I said, it is mainly through the cough droplets, by coughing, by spitting around, by sneezing. Yeah, these are the ways.
Okay. So how is tuberculosis treated, and is there any vaccine for TB?
Tuberculosis treatment consists of the anti-tuberculosis drugs. We have mainly the four medicines, that is isoniazid, rifampicin, pyrazinamide, ethambutol. These are the primary drugs which are used for TB treatment. TB can affect any part of the body except for the hair and the tooth and the nails. No other body part can be spared. So the TB treatment remains almost the same for any part with plus minus a few drugs. And but the duration may vary from 6 to 9 months to 12 and sometimes even 18 months. Then there is a multi-drug resistant TB, usually when patients have repeated courses of TB or they do not complete the TB treatment properly or are irregular with the treatment. They can have a multi-drug resistant TB. The treatment and the medications vary for that disease.
Okay. So, ma'am, what's your thought about the disease for early prevention?
TB is widely prevalent in our country, especially in our country compared to other countries in the world. There are various myths associated with TB which have to be broken. First, as I said, it is not a disease caused by some evil spirits or any other factors. It is a bacterial disease transmitted from one person to another through the bacteria. So this people have to understand that this is a treatable disease. Usually there is a social stigma associated with TB. People do not come out with their symptoms. They are reluctant, they are hesitant to tell it to the society or even to the doctors that they have symptoms of TB. So this attitude of the people has to be changed. This is like any other infectious disease that can be treated. For prevention, proper hygiene practices have to be practiced. that is coughing with the mouth covered, either towards the elbow or the hand, or with a proper handkerchief. And that handkerchief also has to be cleaned and disposed properly. People should not be spitting around anywhere, because as we say, the cup droplets are the ones which can cause. So the spitting has also to be taken care of. Some people do have the feeling that we should not sit with the TB patients, we should not talk with the TB patients, TB can spread by touching. No, these are not the factors. So a TB patient can communicate and do other things until he is wearing a mask or covering his mouth properly. Secondly, TB is a disease of immunity. So as long as our immunity is strong, our health is strong, we have lesser chances of having a severe disease. Many a times the TB bacteria may actually enter, and if the TB bacteria, the viral load is less, our immunity is strong, it may just pass off without affecting the person. So the people have to have their diet properly, the immunity should be strong.
Okay,
Thirdly,
so ma'am, yes, ma'am, would you like to suggest some tips for immunity, like people, how to increase their immunity?
Proper fruits, vegetables, and a healthy diet is the main thing that immunity has to be strengthened. Second, a proper hydration is necessary. In this busy life, people tend to miss out on their meals, on their breakfast, on their lunches.
Yes.
So whatever happens, these things are to be stressed, that you should not be missing any of your meals, because this is very important for your immunity. Secondly, as I mentioned, hydration is important. Third, a proper sleep, at least 6 to 8 hours of sleep. People are so much glued with their work, with mobiles and screens, that the sleep is compromised a lot. But even if you feel you can work the next day, you're not sleepy, the immunity is certainly compromised in these conditions. Earlier, when the TB medications were not discovered, the treatment of TB was just proper diet and a good sunlight. So this works even today. Along now, we have the benefit of having the drug. So just a good air, a good sunlight, and a healthy diet is apt for this.
Okay. I hope all these information must help our audience to protect them against this disease. So thank you so much, ma'am, for giving your these valuable insights about the disease.
Thank you. Thank you very much.